What if the blood pressure number your doctor celebrates today could actually be the wrong target for your body tomorrow? For many older adults, the answer is not simply, lower is always better. The real question is, what blood pressure level helps you stay healthy, active, independent, and safe? In this video, we'll uncover what research really tells us about blood pressure in older adults, why the perfect number on a chart may not tell the whole story, and what factors can change the right target for different people. Because when it comes to blood pressure after age 65, one number does not fit everyone. For decades, many people have heard the same message: keep your blood pressure as low as possible. A reading around 120/80 has often been considered ideal, and for many adults, controlling high blood pressure is one of the most important steps to reduce the risk of heart disease and stroke. But as we get older, the body changes. The heart, blood vessels, kidneys, and nervous system do not respond exactly the same way they did decades earlier. That means managing blood pressure becomes a balance between protecting the heart and protecting everyday quality of life. Imagine a person named Margaret. She is 78 years old, independent, enjoys spending time with her family, and has always followed her doctor's instructions. Over the years, her blood pressure medications increased because her readings were considered above the ideal range. Eventually, her numbers looked excellent on paper. Her blood pressure was lower than ever before. But Margaret started noticing something strange. Whenever she stood up quickly from a chair, she felt lightheaded. Some mornings, she had to hold onto the kitchen counter for a few seconds before walking. She thought it was just part of getting older. Then one day, she lost her balance. Thankfully, she avoided a serious injury, but the experience changed the way she viewed her health. The number on her blood pressure monitor looked great, but it did not explain what was happening inside her body during everyday activities. And this is the important lesson. A blood pressure reading is a snapshot. It does not always show the full story. So what is the best blood pressure for older adults? The answer depends on several things, including age, overall health, medications, activity level, and whether someone experiences symptoms like dizziness or weakness. Let's explore what you need to know. Why blood pressure goals change with age. As people age, their cardiovascular system naturally changes. One major change is that arteries often become less flexible. Younger blood vessels expand and contract easily, helping maintain steady blood flow. Over time, arteries can become stiffer, which affects how pressure moves through the body. This change is one of the main reasons blood pressure tends to rise with age, especially the top number, known as systolic blood pressure. As the heart pumps blood into stiffer arteries, it must generate greater force to keep blood moving efficiently throughout the body. This can result in higher systolic readings, even when the lower number, called diastolic blood pressure, remains relatively stable or even decreases. Because of this natural process, many older adults experience isolated systolic hypertension, a condition that becomes more common after the age of 60 and requires careful monitoring rather than being ignored as a normal part of aging. At the same time, aging affects more than just the arteries. The body's systems that regulate blood pressure, including the kidneys, hormones, and nervous system, may not respond as quickly or effectively as they once did. This means blood pressure can fluctuate more throughout the day, changing with activities such as standing up, exercising, or even after eating a meal. These natural shifts are one reason healthcare providers often recommend taking multiple blood pressure readings over time instead of relying on a single measurement, giving a clearer picture of overall cardiovascular health rather than focusing on one isolated number. Another important change involves the body's ability to quickly adjust blood pressure when you change positions. When a younger person stands up, the nervous system rapidly increases blood vessel tightening and heart activity to keep blood flowing to the brain. But in older adults, this adjustment can become slower. This is why some people experience what is known as orthostatic hypotension, a condition where blood pressure drops after standing. The result can be dizziness, imbalance, or feeling unsteady. This does not mean older adults should ignore high blood pressure. High blood pressure remains a major risk factor for serious health problems. The key is finding the right balance. What research says about lower blood pressure targets? Large studies have shown that lowering blood pressure can reduce the risk of cardiovascular problems in many people. One well-known study examined whether intensive blood pressure control could provide additional benefits compared with standard treatment. The results suggested that lower targets may help certain groups reduce cardiovascular risks. However, there is an important detail many people miss. Clinical studies usually involve specific groups of participants. They may exclude people with certain medical conditions, significant frailty, advanced illness, or multiple health challenges. Real-life patients are often much more complicated. A healthy 68-year-old who exercises regularly and takes few medications may respond very differently from an 85-year-old who takes several prescriptions and has balance issues. That is why doctors often consider the whole person, not just one number. The hidden problem with chasing a perfect number. Many older adults focus only on the top number, called systolic blood pressure. But the bottom number, called diastolic blood pressure, can also provide important information. Blood pressure that becomes too low may affect how well blood reaches certain organs, especially during moments when the body needs quick adjustments. This is why symptoms matter. If someone has a blood pressure reading that looks excellent but experiences frequent dizziness, unusual tiredness, weakness, or balance problems, that information should not be ignored. The goal of treatment is not just to create a beautiful number on a medical chart. The goal is to help a person live a healthier and safer life. So what blood pressure range is right after 65? There is no single perfect number for every older adult. For some healthy older adults, a lower blood pressure target may be appropriate, especially when it can be achieved safely without side effects. For others, a slightly higher range may provide a better balance between reducing cardiovascular risks and maintaining stability. A person in their 60s who is active, independent, and otherwise healthy may have different goals than someone in their 80s with multiple medications or a history of falls. This is why personalized care matters. Your age alone does not determine your ideal blood pressure. Your complete health picture does. The simple test. Many people forget. One useful thing many older adults can discuss with their healthcare provider is checking blood pressure in different positions. For example, blood pressure can sometimes be measured after resting and then checked again after standing. This can reveal whether the body is struggling to maintain stable circulation during position changes. If you frequently feel dizzy when standing, mention it. Do not assume it is simply normal aging. Sometimes symptoms provide important clues about whether a treatment plan needs adjustment. Questions to ask your doctor. Instead of asking only, "Is my blood pressure number good?" try asking deeper questions. Is this target right for my age and health condition? If this video helped you understand blood pressure in a new way, make sure to like the video, share it with someone who could benefit, and subscribe for more simple health explanations designed to help you make better informed decisions. And remember, your health is more than a number on a chart. It is the ability to live safely, confidently, and fully every day.